Thank you for joining us today. My name is Nicole Strock, Employee Benefits Manager for Butte School's self-funded programs, and today we're going to be discussing the annual open enrollment for the plan year of 2023 through 2024. Let's get started with new benefits. We are thrilled to offer voluntary universal life insurance with long-term care through Trustmark. Universal life insurance through Trustmark provides lifelong protection with flexible premiums. It's one policy with two benefits: life insurance coverage for your family and long-term care benefits if you need them. Coverage is available to all active employees enrolled in a BSSP medical, dental, vision, and/or life insurance plan. Coverage is available for yourself, your spouse, and your children, and you can take it with you when you leave your employer or retire. It provides benefits for long-term care services such as home health or nursing home care. You can access up to 4% of the selected life insurance benefit per month for up to 25 months if you need long-term care. If you collect a benefit for long-term care, your full death benefit is still available for your beneficiaries. BSSP will be holding another enrollment opportunity from June 19th through June 30th. Keep in mind, premiums are based on age. The younger you are when you enroll, the more benefit you receive for the same premium. And during this enrollment period only, you have a special opportunity to enroll without answering medical questions. Employees can request up to $150,000 and spouses can request up to $15,000 without answering medical questions. CISC has introduced an additional added value benefit to the non-HSA medical plans effective now. Eden Health is a chat and video-based option for primary care, mental health support, and answers to follow-up care questions through one easy-to-use app. Eden Health is free for members on non-HSA plans. HSA plan members are not eligible for Eden Health. Now let's take some time to discuss resources you have available 24 hours a day, 7 days a week. When you have a question, whom do you call? If you have questions regarding when your coverage begins and ends, changes to your coverage, or the cost of your coverage, we ask that you reach out to your employer. If you need information regarding network providers, questions on a claim status or payment, or your year-to-date out-of-pocket maximums, please contact the carrier. If you have problems with the carrier after 1 or 2 phone calls, please contact BSSP. We are happy to help and assist in explaining your plan limits as well as helping resolve any claims issues that arise. You can reach us at 530-879-7438 or also via email at bssp@bsspjpa.org. You have access to your benefit information anytime, anywhere via our carrier portals. We encourage you to register your portal with the Maribin, which is our new claims administrator. Through your portal, you can view claims, update coordination of benefits, and order ID cards. Please contact BSSP if you have any trouble registering your account. In addition to the online portals, you have apps available for all of our benefits, so we encourage you to download those on your smartphone or tablet. For more information and helpful videos, visit our website at bsspjpa.org and click on the Podcasts and Videos button. Another important resource you have available throughout the year is your Benefits Overview Guide. You will receive a copy of this year's version from your employer, which provides you with many great insights to your benefit options. BSSP distributes monthly and sometimes more frequent emails. We use these to communicate important benefit information throughout the year. If you aren't receiving these emails, please email us at bsspj.org so we can add you to the distribution list. Our focus on well-being includes the Employee Assistance Program through Anthem. Sometimes life throws you a curveball or is just a little more complicated than usual. The EAP can help lend a hand in referring you to services that you need. All employees are eligible for the EAP program regardless of enrollment in a BSSP medical plan. The EAP entitles you and your family members or household members to short-term counseling services as well as access to informational websites at anthemeap.com. Each person is entitled to 6 sessions per incident per year. The EAP program also offers legal and financial counseling sessions. As a reminder, the service is completely confidential. Now let's move into the completing open enrollment section of the presentation. This time of year, many ask, do I need to do anything to complete open enrollment? For this year, the short answer is yes. Everyone needs to complete open enrollment. Changes made to district and bargaining unit medical plan menus may have resulted in a change to your personal medical plan. As a reminder, this is your only opportunity to make changes without a qualifying event. Remember, qualifying events such as marriage, divorce, birth, and death of a family member, or changes in employment provide an opportunity to make a change within 31 days of that qualifying event. We recommend that you don't make changes in anticipation of a qualifying event during this open enrollment period, but wait until that 31-day period associated with the qualifying event. Also, a divorced spouse is no longer eligible for coverage on the first of the month following the notice of entry of judgment, so please be sure to notify BSSP and your district immediately upon receipt. We encourage you to utilize the Plan Cost Estimator tool to help guide you in selecting your medical plan. On the Input tab, you will input your district and bargaining unit, whether you're an active employee or a retiree, and the amount of your district contribution towards your medical benefits. Then you will input general claims usage. For example, maybe you have 1 preventive visit, 2 visits with a specialist, some diagnostic imaging, and maybe a prescription. There is no need to review your past year's EOBs. This tool is designed to be a general big picture look at your plans and costs associated with each. On the results page, you'll see 3 scenarios displayed. Preventive care, which would be the best case scenario. Your expected use, which is going to be based on what you put in your claims information on the Input tab, and then the maximum out-of-pocket, which would be the worst case scenario. You will find that your experience will be somewhere in the range of all 3. You are welcome to input multiple scenarios to best estimate your situation.
There are a number of resources available to you throughout the open enrollment period. You can visit the BSSP website at bsspjpa.org. You can set up a benefits counseling appointment with the BSSP team, American Fidelity, or EOI for long-term care. You have other resources available to you as well, including videos on demand and, of course, your district benefits staff.
All active employees must make their elections through the My Health Benefits portal. From BSSP's homepage, click the Open Enrollment button. From the Open Enrollment page, click the My Health Benefits button. If you've registered for My Health Benefits in the past, you will use the same username or password you have set up. If you're accessing My Health Benefits for the first time, you'll need to create a new account. If you don't remember your username or password, please use the Forgot Username or Password tools. The My Health Benefits portal reflects the employer contribution for full-time employees. If you are a part-time employee or retiree, that information will be provided from your employer directly. If you're double covered for medical benefits within the BSSP program, the 25% double covered discount will not display within the My Health Benefits portal, but will be updated on your October paycheck. You must make all elections through the My Health Benefits portal by July 13th at 3 p.m. If you are currently enrolled in a flexible spending account for unreimbursed medical or dependent daycare with American Fidelity and wish to continue participating, you must meet with American Fidelity each year to re-enroll. If you are interested in any other insurance plans available, please schedule an appointment with a representative. If you are an employee of Bangor Union, Butte College, Orville Union High School District, Palermo Union, or Paradise Unified, please check with your HR payroll representative about opportunities available within your district. Let's review the medical benefits. Rate increases on Anthem plans vary from 4.1% to 7.8% for an average increase of 6.1% overall. CISC's statewide renewal averaged 8%. This is the 9th year that CISC has been able to offer single-digit renewal increases, and we are pleased to continue this partnership. BSSP has streamlined the medical benefit options this year. There are no changes to the non-HSA underlying deductibles, coinsurance, or copayment structure for the medical portion of the plans. BSSP has updated all non-HSA plans to the $10, $200, $35 prescription option. If you are currently on a non-HSA plan with the $7025 prescription option, your generic copay at retail pharmacies will be $10. If you're using Costco, copays are $0. If you have a name brand medication, the brand name deductible per person is $200 up to a maximum of $500 per family. And finally, after deductible, the brand name copay for a 30-day supply is $35. The deductibles run on a calendar year basis just as your medical plan. However, the first fill after October 1st will be subject to that $200 deductible. Plans with HSA in the title have been renamed, but there are no changes to the underlying medical or prescription coverage. The current HSA-A plan is now named HSA 1500. The current HSA-B plan is now named the HSA 3000 plan, and the current MEC HSA is now HSA 5000. The numbers represent the individual deductible of each plan. CISC has also introduced a new minimum value plan, the HSA 9000, which is available under most district and bargaining unit menus. This plan is designed to be similar to the minimum plan options under the Affordable Care Act. So how do you choose your medical plan? Plans with lower deductibles and/or out-of-pocket maximums means that you are paying a lower amount at the time of service. However, plans that have lower deductibles and lower out-of-pockets do result in higher monthly premiums. Many of the critical factors are the same between each of the plans. All plans cover the same network, providers, and facilities, the same services. All plans have the same prior authorization criteria. All preventive care is paid at 100% with network providers. All plans subscribe to the same prescription formulary, and all plans offer coverage away from home. When evaluating the differences between BSSP's medical plan, we encourage you to focus on the differences. Each plan will have a different monthly premium, which means a different impact on your paycheck, either an additional withholding or your share of the monthly rate. Each plan will have a different amount for what you pay in a claim in deductible, copay, and coinsurance costs. Also, something to keep in mind is that HSA plans do require you to pay 100% of the cost of your care, including prescriptions, until your deductible is met. So when evaluating your plans, we highly encourage you to focus on what's different between each medical plan.
When choosing your medical plan, here are some questions to consider. How often do you have medical and prescription claims? Can you save some of the premium difference by selecting a lower cost medical plan? And what other ways can you reduce your out-of-pocket costs for medical services?
Our health and wellness centers are here to serve both you and your family for preventive, primary, and urgent care needs. Barbara, Sally, David, Ben, and Shannon are available in Chico and Orville to meet a broad range of your urgent, acute, preventive, and disease management medical needs. Each of our providers does have a unique area of focus, but they can all diagnose, treat, dispense, and prescribe or refer for the same broad scope of illnesses, diseases, and conditions. Most services at the health and wellness centers are free, and prescriptions are just $4 or $8. If you are enrolled in an HSA plan, appointments are $25, but do also include prescriptions at no cost. We have an on-site lab as well as an on-site dispensary for your prescription needs. Our providers have the ability to consult with a panel of specialists to provide you the most specialized care without any additional cost at the Health and Wellness Center. We offer convenient and extended hours at both of our locations. BSSP and CISC offer a variety of added value programs. As we discussed earlier, the Anthem EAP program is available to all employees and everyone in their household. Anthem EAP offers the Learn to Live emotional well-being program as well. With this program, you'll learn effective ways to manage stress, anxiety, depression, substance use, and sleep issues through the proven principles of cognitive behavioral therapy. To access Learn to Live, please visit the anthemeap.com website, enter the company name CISC, and then click on the Emotional and Wellbeing Resource button on the right-hand side of your page. The next few added value benefits are available to members enrolled in a medical plan. Teladoc Medical Experts provides an opportunity for expert medical opinion at no additional cost. This is a tremendous benefit when you are facing a new diagnosis, have recently been released from the hospital, or have been prescribed a new treatment plan. Simply contact Teladoc online or via phone and you will be matched with an expert in your field of need. Teladoc will gather your chart notes and diagnostic reports from other providers and review with a panel of experts. They may confirm your diagnosis or treatment plan or provide an alternate diagnosis or treatment plan. Again, this benefit is available at no cost on all medical plans. Telehealth services are available through MD Live and are a great option when you can't access the Health and Wellness Center. Your appointment is conducted via phone or video chat over a secure system. In addition to general medical conditions, MD Live also offers behavioral health treatment with licensed psychiatrists and therapists. To access MD Live services, please visit mdlive.com/CISC. The Carum Surgery benefit provides a concierge experience for hip and knee replacements as well as spinal fusion and dissectomies at Scripps Hospital in San Diego and Stanford Valley Care in Pleasanton. Benefits include paid travel costs for you and a travel companion. There is no cost for members on a non-HSA plan. For members enrolled in an HSA plan, you are subject to the balance of your unmet deductible. Through Contigo Health, members with a cancer diagnosis have access to the City of Hope's Oncology Center of Excellence. This program provides consultation, treatment, and plan development at no charge for those on an HSA plan. If you are enrolled on an HSA plan, services are subject to your deductible. You may have an evaluation either in person or via phone. You will develop a customized treatment plan, receive personalized care coordination, as well as access to clinical trials and genetic risk education. Your team at the City of Hope will follow you for up to 1 year post-evaluation to ensure that you are carrying out your recommended treatment plan, track your progress, and make any adjustments as needed. Maven is a free, on-demand maternity and postpartum support service available to employees and covered spouses or partners enrolled in a medical plan. Maven is available to members from the onset of pregnancy up to 1 year postpartum. Maven connects expectant mothers with a variety of resources from OBGYNs, midwives, nutritionists, and mental health specialists that can supplement the prenatal care already being provided by your doctor. Postpartum services include lactation counseling and sleep coaching, as well as return to work support. Expectant spouses or partners can also enroll in their own track with content specifically designed for the non-birthing partner. CISC is offering a free 6-month diaper subscription for those who enroll in the Maven program within their first trimester. The final 3 added value programs are available to members enrolled in a non-HSA plan only. Virtual primary care through Eden Health is the option for which you may have a chat or video appointment with a provider for primary or preventive care. Vita Health offers you access to virtual care platforms with one-on-one coaching and support for a full range of lifestyle, chronic, and behavioral conditions. To sign up for Vita, download the Vita app or visit vita.com. And finally, Hinge Health provides digital physical therapy to conquer back and joint pain, recover from injuries, prepare for surgery, or just to stay healthy and pain-free. Once engaged with Hinge Health, your personalized therapy sessions are tracked using wearable devices which link to a tablet, both provided to you by the Hinge Health program. To get started, visit hingehealth.com/CISC. We have just a few other important reminders on our medical plans. The value-based site of care provision applies to arthroscopy, cataract surgery, colonoscopy, upper GI endoscopy with or without biopsy. If these procedures are performed at an ambulatory surgery center, there is no benefit limitation. Currently, Skyway Surgery Center is the only ambulatory surgery center in Butte County performing the above procedures, with the exception of cataract surgery, for which there are other options. The value-based site of care provisions limits the amount paid for hospital-based, non-ambulatory surgery center facility charges to those listed above. The patient will be responsible for the facility charges in excess of those listed here, and there will be no credit toward the patient's out-of-pocket limits for those excess charges. Exceptions are granted if they are requested prior to the service. If the physician provides clinical justification for using a hospital, if a member lives more than 30 miles from the ambulatory surgery center, if a procedure cannot be scheduled in a medically appropriate, timely manner due to the ASCs not having availability, and of course in an emergency. We cannot stress enough that these exceptions may be granted, but only if they are requested prior to your service. The physician who will be performing the service will be the one to request that exception from AmeriBen. If you have any questions, or if you are at the point of being ready to schedule one of these procedures, please ensure that you let your provider know that you have this provision under your policy and that they need to request that exception if they are not going to be performing your service at an ambulatory surgery center. Other facility restrictions relate to bariatric surgery, overnight routine hip and knee replacements, overnight spinal fusions or laminectomies, as well as organ and tissue transplants. Bariatric surgeries require a Blue Distinction Center designation. Here in Butte County, Enloe Hospital does have that designation. Overnight routine hip and knee replacements do require a Blue Distinction Plus Center to have that designation, which Enloe also does. Recently, we have become aware of folks having their hip and knees replaced at an outpatient surgery center. This facility restriction does not apply to outpatient surgeries. This is strictly having to do with overnight stays. And again, overnight spine laminectomies and fusions do need to be performed at a Blue Distinction Plus Center. Currently, there are no facilities in Butte County that qualify as a Blue Distinction Plus Center for spinal surgeries. The nearest locations would be Mercy Hospital in Reading or Woodland Memorial in Woodland. There are other locations available throughout the state. Please visit the Anthem website to find care that meets your needs. Unfortunately, double medical coverage does not provide double medical benefit, and with the elimination of the benefit reserve provision through CISC contract with Anthem and AmeriBen, BSSP recommends one spouse within the double covered household enroll in the waiver fee plan, and the other spouse take the plan the family wants to be on. The spouse on the waiver fee plan will receive all of the benefits of the medical and prescription coverage as a dependent without having their own enrollment record with AmeriBen. Children should be enrolled under the spouse that is not electing the waiver fee plan. Another option is for one spouse to enroll in the minimum plan and the other spouse enroll in the plan the family wants to be on. With double coverage, you have the best of two plans as if it was your only coverage, but no more. A lower plan will not reduce the out-of-pocket costs of a richer plan. However, when it comes to prescription coverage, we recommend only submitting prescriptions to the richer of the two benefits. If you are considering option 2, your medical claims must be first submitted to your primary plan and then to secondary. Employees are always primary on their own coverage, and children are generally primary under the parent with the birthday earliest in the calendar year. Also, under both options, spouses enrolled in a composite rated plan will receive a 25% premium reduction. Unlike medical, 2 dental plans do truly provide a double benefit, as well as 2 vision plans for allowances as well as frequencies. And for life insurance, if you are covered within BSSP's life insurance with the Hartford, you may not be covered as an employee as well as a spouse under voluntary life insurance coverage. Each spouse may only elect optional coverage under themselves. Here's an illustration of how costs accumulate toward the out-of-pocket maximum on non-HSA plans. First, you must meet your deductible. Deductible applies to services such as tests, including labs and imaging, procedures, either in or outpatient, and hospitalizations, just to name a few. Remember, you pay 100% of the claim until the deductible is met. You may also pay flat dollar co-payments for office visits. For these claims, amounts are applied to your out-of-pocket maximum. In addition to your deductible, there is a $100 copay that also applies for emergency room visits when you're not admitted. Once you've met your deductible, then you pay a portion of each claim via coinsurance, which is a percentage of the claim. When you pay the coinsurance, the plan pays the balance of the claim. The amount that you've paid toward deductible, co-payments, and coinsurance accumulate toward your out-of-pocket maximum. After you've reached the out-of-pocket maximum, the plan pays 100% of allowed claims for the balance of the plan year. Under HSA plans, all services, including prescriptions, apply to the deductible. Copays are subject on the HSA plans to prescriptions, as well as the emergency room copay in addition to deductible charges. Once your deductible is met, then you pay a percentage of coinsurance until the amount paid for deductible plus copays plus coinsurance reaches the out-of-pocket maximum under your plan. Once you've reached that out-of-pocket maximum, the plan will pay 100% of the cost of services for the balance of the plan year. Let's review how out-of-pocket costs accumulate toward the individual and family out-of-pockets. Each plan has a family deductible and out-of-pocket limit. As family members incur claims, those claims are applied to the family limits. The claims are also applied to the individual's limits. Let's look at family member number 1. He incurred claims, and those are applied to both the family limit and to his individual limit. Then family number 2 has claims, which are applied to both the family limit as well as her individual limit. With these claims, she has met her individual limit. Because her individual limit has been met, the plan will pay 100% of her costs for the balance of the plan year. Family member number 3 has claims, and those are also applied to both her individual limit, which is not displayed on the screen due to size, as well as the family limit. With her claims, the family has now reached the family limit. For all future claims, the plan will pay 100% because the family limit has been met, even though each individual limits have not been met separately. You will never pay more than the individual limit for any one person under the plan, nor the family limit in total. Now let's discuss dental, vision, and life insurance benefits. On our dental plans, we have another year with no rate increase, and this year we've made some enhancements. Effective October 1st, diagnostic and preventive services will no longer apply to the calendar year plan maximum under all 4 dental plans. Additionally, plans 10 and 12 will now cover 100% of orthodontia services up to the $2,000 lifetime maximum. Most employees have the option to pick from one of these 4 plans. Plan 1 is a traditional Delta Dental plan that subscribes to only the PPO network. This plan provides cleanings and preventive care services at 100%, fillings are paid at 80%, crowns, bridges, and implants are paid at 50%. This plan does have a calendar year deductible of $50 per person, up to $150 per family. Plans 8, 10, and 12 are what we call incentive style plans. These plans begin at 70%, and as long as you utilize the policy each year, you'll receive 10% increases in your incentive until you've reached 100%. As long as you don't have a break in coverage, you will remain at 100% for the lifetime of your coverage. Plan 8 is the same as Plan 10, with the exception of the orthodontia benefit. Plan 10 offers a $2,000 orthodontia benefit per covered family member. Plan 12 is the same as Plan 10 with an additional $3,000 calendar year benefit for both PPO and Premier providers compared to the $2,200 or $2,000 calendar year benefit under Plan 10. One important note, if you make a decision to move down to Plan 1 from either Plans 8, 10, or 12, and then at a later year decide to move back from Plan 1 to Plans 8, 10, or 12, you will restart at that 70% incentive benefit level because Plan 1 is not an incentive style plan. Our VSP vision plans have another year without rate increases, and like dental, we've made some enhancements to the vision plans. Effective October 1st, members will be able to use their frame allowance toward sunglasses or blue light glasses without the need for a prescription under the Light Care benefit. Walmart and Sam's Club will now also be participating providers for frames and will have the same $135 frame allowance as is available through Costco. In addition, the frame allowance under the Computer Vision Care benefit is increasing from $90 to $130. Most employees have the option to pick from one of these 4 plans. Plan 4 is our base plan that offers exams and lenses every 12 months and frames every 24 months with a $250 frame allowance. Plan 8 is the same as Plan 4, but it allows frames every 12 months. The plans designated with an X are the same as the base plans, either Plan 4 or Plan 8. However, they both allow an annual supply of contacts for $50 in addition to your frame allowance under base Plan 4 or 8. This additional enhancement can be very helpful for those who both wear contacts and glasses. All plans do offer the Kids Care benefit, which allows children under age 17 up to 2 exams per year within a 12-month period, as well as frames every 12 months regardless of the plan you're enrolled. The Computer Vision Care benefit is also available on all plans, and this benefit provides an enhanced exam to detect eye health issues related to excessive computer use. The Vision Care plan also offers a $130 frame allowance for materials specifically related to computer use. Some employers provide $10,000 or $50,000 of group term life and accidental death and dismemberment insurance through BSSP and the Hartford. If so, you have the option to purchase employee, spouse, as well as child supplemental life insurance. Employees may purchase supplemental insurance in increments of $10,000, ranging from $10,000 to $300,000. Evidence of insurability is required annually if you're increasing more than $10,000 or more than a total of $100,000. For spouses, you may purchase in increments of $5,000 to up to a maximum of $100,000. In order to purchase spouse life insurance, you must be purchasing a minimum of $10,000 in employee supplemental life insurance. Evidence of insurability is required when the increase is more than $5,000 annually or more than a total of $30,000. Child life is also available in $5,000 flat policy. Minimum 10,000 employee supplemental life insurance must be purchased as well in order to purchase child life insurance. Let's take this opportunity to review the benefit cycles. Under HSA medical plans, plan limits reset each year on January 1st. As we move through the calendar, open enrollment is held from May through mid-July. October 1st is when plan and premium changes are made. Under non-HSA plans, plan limits do still reset on January 1st in most cases. Open enrollment is in May through July, mid-July, and plan and premium changes are effective October 1st. However, the non-HSA plans do have the fourth quarter carryover provision for claims applied to the deductible only between the months of October, November, and December. When you have claims applied to your deductible in the fourth quarter of the calendar year, when your plan resets in January, you may have additional dollars applied to your deductible from fourth quarter carryover beginning the following January. For dental plans, your benefit maximums and incentive percentages increase on January 1st. As with medical, open enrollment is held from May through mid-July, and any plan or premium changes are effective October 1st. For the vision plans, open enrollment is still held in that same May through mid-July timeframe, and plan and premium changes are still effective October 1st. However, vision benefits are available either 12 or 24 months from the last date of the same service, not tied to any particular calendar period. Let's take a look at medical plan cycles when making a plan change effective October 1st. If you are making a plan change from a non-HSA plan to another non-HSA plan effective October 1st, any medical and prescription claims that you've incurred for the first part of the plan year will carry over to your new plan effective October 1st through the remainder of the calendar year. Please keep in mind, if you are moving from a plan that has a lower deductible or out-of-pocket maximum to a plan with a higher deductible or out-of-pocket maximum, you will have some additional dollars to meet if you have claims. Fourth quarter carryover does apply to deductible claims only for dates of service from October 1st through December 31st. If you are moving from an HSA plan to another HSA plan effective October 1st, your medical and prescription claims will carry over to your new plan effective October 1 through the remainder of the calendar year. Again, please keep in mind, if you are moving to a plan that has a higher deductible or out-of-pocket maximum, you may have a balance to meet effective October 1st for the remainder of the calendar year. Fourth quarter carryover does not apply to HSA style plans. If you're currently enrolled in an HSA style plan and you're considering electing a non-HSA style plan, any medical claims that you've incurred through September 30th will carry over to your new plan effective October 1st. This does not include claims applied to your prescription benefits. You are eligible for fourth quarter carryover for amounts applied to your deductible for October, November, and December. Finally, if you are deciding to move from a non-HSA plan to an HSA plan effective October 1st, carryover of claims prior to October 1st is not allowed per IRS statute. What this means is that beginning October 1st, under the new HSA plan election, you will have your new plan's deductible and out-of-pocket maximum. When the calendar year resets in January, you will start back at zero effective January 1st. Also, HSAs are not eligible for fourth quarter carryover. Let's review the voluntary benefit options you have through BSSP. Universal Life with long-term care is available to active employees enrolled in a BSSP medical, dental, and/or vision plan. Coverage is available for yourself, your spouse, and your children. You are able to access up to 4% of the selected life insurance benefit per month for up to 25 months if you need long-term care. If you collect a benefit for long-term care, your full death benefit is still available to your beneficiaries. The plan is portable, meaning you can take it with you at the same rate if you change jobs or retire. Voluntary pet insurance is being offered through Pets Best to all employees and retirees enrolled in a BSSP medical, dental, vision, and/or life insurance plan. Pet insurance helps provide peace of mind by reimbursing you for future veterinary bills. You can use any vet in the United States, including specialty and emergency clinics. There are no waiting periods for coverage with the exception of cruciate ligament issues, which does have a 6-month waiting period. The policies do exclude pre-existing conditions up to an 18-month look-back period. Claims can be filed online via the Pets Best app or the Pets Best website. The Voluntary Ambulance Cost Reimbursement Plan through MASA is available to employees and non-Medicare retirees already participating in a BSSP medical, dental, vision, or life insurance benefit. The plan reimburses you for amounts applied to deductible, copayment, and coinsurance for emergency ground or air transportation anywhere in the United States or Canada. It is important to note that there is no reimbursement under this plan if you have already met your out-of-pocket maximum. The plan does provide for additional benefits for transportation if you are hospitalized more than 100 miles from home. The cost of the plan is $14 per month. American Fidelity offers employees of participating districts comprehensive voluntary benefits to complement your BSSP coverage. American Fidelity offers one-on-one open enrollment and voluntary benefits counseling with an American Fidelity counselor that has been trained in BSSP benefits by the BSSP staff. Your district may be scheduling time for in-person visits at your site, and you also have the option to schedule a telephone or virtual appointment. As we discussed previously, you must meet with American Fidelity to renew your FSA election each year. If you are interested in purchasing additional disability, hospital indemnity, accident only, critical illness, whole life, or cancer insurance, please meet with an American Fidelity representative. Thank you very much for joining us today. For further information, please contact BSSP at 530-879-7438 or email us at bssp@bsspjpa.org. Take care.